Hi, my name is Hunter Bailey, and today I'm going to be doing the indwelling catheter insertion. Here's my College of Nursing ID badge, and you can go ahead and scan the room. So my first step is going to be to verify the physician's order and verify hospital policy. So there's an order to insert and maintain an indwelling urinary catheter and place on nurse-driven protocol to remove the catheter when indications are no longer present. 3 indications would be a required immobilization for surgery, trauma, or other therapies, to assist in the healing of open sacral or perineal wounds in incontinent patients, and acute ventilator-dependent respiratory failure. Now I'm going to perform hand hygiene. Identify my patient using 2 patient identifiers. So Jaguar Jones, medical record number 4176352, medical record number 4176352. I'm going to assess for allergies. So he's allergic to penicillin, and there's an armband that says penicillin. Mr. Jones, today I'm going to be giving you your indwelling catheter. Do you have any questions? No? Okay, good. I'm going to provide privacy, and I would wash my hands. So now what I'm going to do is I have all of my equipment gathered that I need to insert my Foley catheter. I'm going to don my goggles, position my trash can, and perform hand hygiene. Raise the bed up to a comfortable working height, lower the side rails, and put my patient in dorsal recumbent position. So I would bend the knees, bend them up, and then spread them out so I can have a comfortable working space. Now I would wash my hands, and I would don my clean gloves and perform perineal care. For a male patient, I'm going to start at the urinary meatus and cleanse the glans penis in a circular motion, switch parts of my washcloth, cleanse the shaft of the penis, switch parts of my washcloth, cleanse the scrotum, and then switch parts of my washcloth. And I would cleanse the inner thighs, but I would cleanse the inner thighs first. Just want to go ahead and note that I would cleanse the inner thighs first and pat dry. For a female patient, I'm going to cleanse the inner thighs, then I'm going to spread the labia. After I switch part of my washcloth, cleanse the far labia, switch washcloths, cleanse the near labia, switch, and then cleanse right down the middle, and then pat dry. Now that I have performed perineal care, I'm going to open my catheter kit, and I'm going to use the bag that it came in as a trash can. Normally, what I would do is I would place this right beside the patient on the other side of the bed or near me, and this is what I would use. That's where I would place it, but I'm very limited on today's space because I'm on my kitchen counter. So I'm just going to place it right here so I don't break sterility in any way, but normally I would place it about right here. So now I'm going to open my catheter kit away from me to the sides and then towards me. Going to don my sterile gloves. And I'm keeping my thumb away. My thumb's out, and then I'm going to adjust. I'm going to grab my sterile drape. Okay, and the shiny side goes down. So I'm going to take it and place it for my patient. It will also serve as a waterproof pad. Also, if I was dealing with a male patient, I would have a fenestrated drape, and then I would use that as well. So now I'm going to adjust to make sure that there's no gaps. Okay. Now I'm going to take my box, move it forward just a little bit, and remove the plastic part. Now what I'm going to do is I'm going to take my cleansers, my iodine swabs, dispose of it in the trash, and go ahead and sit these out for use. So I'll go ahead and sit those out and dispose. And now I would I'm going to pick this up right here just because I want to place my saline in this compartment for easy grabs. So I would squirt my saline into this compartment and dispose. Now I have my syringe and I'm taking the top off, and I'm going to connect this to the catheter. Okay, so now I'm going to remove the plastic from the catheter, and I'm holding it so it doesn't flop when it comes out. I'm going to dispose of this in the trash below me. And for a male patient, I would lubricate the tip 5 to 7 inches, and for a female patient, 1 to 2. So this is going to sit in my lubricant. And while it is sitting in my lubricant, I'm going to go ahead and clean my patient with the iodine swabs. So I'm going to grab a swab. I'm going to open the labia, cleanse the far labia, dispose. I'm going to cleanse the near labia, dispose, and cleanse right down the middle, dispose. If I was cleansing a male patient, I would get my iodine swabs. I would clean from the urinary meatus around the glans penis in a circular motion with my 3 swabs. I'm going to have my hand maintained right here the entire time, spreading the labia. And I'm going to grab my catheter and insert it. Mr. Jones, can you go ahead and take a deep breath for me and exhale, or you can bear down as if voiding. I'm about to insert your catheter. So I'm going to insert until I see urine. Okay, and now I see urine. So now I'm going to, for a female patient, advance 1 to 2 inches. And for a male patient, I would advance all the way to the bifurcation. I'm going to grab with my non-dominant hand and take my sterile hand and inject the saline and inflate the balloon. Now I'm going to remove. For today's purposes only, I'm not going to dispose of my syringe, but what I would do is I would dispose of it right there and I'd be done with it. But specifically for this skill, I'm going to need this later on in the procedure, so I'm just going to sit it right here and pretend that it is a brand new syringe. Now the sterile parts are over, so I'm going to pull back slightly until I feel traction, and then I'm going to advance a little bit more just to take that pressure off of the bladder. I'm going to go ahead and get my stat lock, and this is how you'd open the stat lock. You press the button and open it. So I'm going to connect my stat lock just like this. So then I would cleanse the inner thigh of my patient with a skin prep right here. So I'm going to pretend that this is my skin prep, and I'm going to place the stat lock down firmly. I would remove the sticky part of it, but for today's purposes, I'm not going to do that. I'm going to make sure that there's no traction on the catheter. Okay, now I have my stat lock placed. So now I'm going to take my bag, my drainage bag, and I'm going to hook it onto the bed frame. I would never hook it onto the side rails. And I'm going to make sure that there's no dependent loops and that there's no traction. And so here it is. I'm gonna have my cameraman go ahead and move over, because now I'm going to demonstrate collecting a sterile urine specimen from a catheter that was just placed. So what I'm going to do is I'm going to grab my graduated cylinder, excuse me, my graduated cylinder and my towel. And I would already, before I get on the floor and place it, if this is my break in sterility, I would go ahead and have my sterile my specimen urine container. And what I'm going to do is I'm going to open it and set the top down, move my graduated cylinder. And here's a port right here. I'm going to undo the port, okay, and I'm going to release the urine into the container. Careful not to touch the inside of the container. Once the urine is filled up, I can close this and place it back in. Take my top and conceal it. And I would label on the side, never on the top, and then I would send it to the lab for for whatever reason. So I'd send it to the lab. Now I'm going to demonstrate obtaining a sterile urine specimen from a catheter that's been in for several hours or a couple of days. So what I'm going to start by doing is I'm going to have my container. I'm going to go ahead and sit it down, sit the top right up. I have my syringe ready. I'm going to come over and grab my tubing and clamp it and go ahead and let urine collect. And my bag just fell off, so I would make sure that my bag is still on the side rail. It wouldn't fall off though if we were in the healthcare setting because it would be on the bed rail, but I'm working with a kitchen cabinet, so I'm doing my best. Okay, so what I would do now is I would, while the urine is collecting, I would take my alcohol swab or whatever is for hospital policy, and I would cleanse the drainage port and dispose of this into the trash. Now I'm going to get my clean syringe. I know I'm having to reuse this, but this would be clean. And I would connect to the port. So I'd connect it to the port and draw back the urine. Once I draw it back, I would remove, without touching the inside of the container, release the urine. And I would dispose, but for today's purposes, I'm gonna have to reuse this to discontinue the catheter. So I'm just gonna pretend that it's completely clean. So now what I would do is I'm going to take my urine specimen and I'm going to recap it, label it on the side, never on the top, and send it to the lab. Now I'm going to unkink the tubing and place back to normal, making sure that there is no dependent loops. So now what I'm going to do is I'm going to clean up my mess. So I'm gonna clean up my mess and dispose of it in the trash. I'm going to take off my gloves, my sterile gloves, and I'm going to perform hand hygiene, and then I'm going to raise the side rail of the bed, and I'm going to lower the bed into the lowest position, make sure my patient's comfortable, and have a call light. And then I want to wash my hands before moving on to documentation. And so for documentation, okay, so for documenting, I'm going to document the amount, color, and consistency of the urine, and if a urine specimen was collected, my patient's tolerance of the procedure, and the type and size of the catheter. I also want to note that I would provide daily perineal care. After incontinence of stool, I would provide it with soap and water, and I would remove the catheter as soon as medically indicated, nurse-driven protocol. Okay. So now the time has come to discontinue the catheter. So I'm going to walk to my patient's room and I'm going to wash my hands, provide hand hygiene. So perform hand hygiene and I'm putting on my clean gloves. So now I would come over to my drainage bag and I'm going to drain the bag with a graduated cylinder that has measurements on it, and I would measure and drain the urine. For today's purposes, I'm just going to show you how I would do this. I would not hold it up in the air, but what I would do is I would get a towel, my graduated cylinder, I would release this and drain the urine into the graduated cylinder and measure. I'm going to place this back down for now. So now what I would do after I measured this is I'm going to go ahead and get my syringe and loosen my syringe. On my 10 milliliter syringe, I'm going to use this to drain the water out of the balloon. I want to go ahead and state now that I have been practicing with this 24/7 on this skill. This plunger is just not wanting to cooperate, so it's going to probably not drain by gravity like how it should, but I'm going to do my best. So I'm going to place it to 0.5 milliliter. Okay, so undo the stat lock and get over my waterproof pad. And I would connect this. And like I said, it's not wanting to really fill by gravity. I don't know why, because I've loosened it a million times. But for today's purposes only, I would not do this in the healthcare setting at all, but usually it should drain by gravity. So I'm just gonna give it a little kick because it's just not going to. See, usually it should all come by itself and fill easily. But like I said, I've loosened it a million times and it's just not wanting to do it. But I would not do this. I would let it fill by gravity. So I'm going to sit this down and I'm going to remove the catheter. All right, Mr. Jones, I'm about to remove your catheter. Take a deep breath in and exhale. Okay, and remove it, and then cover it up. Cover all of this up. Get my drainage bag, and I'm throwing everything away into the trash. Now what I would do is I would provide perineal care. So after I touch the trash can, I would remove my clean gloves, wash my hands, put on a new pair of clean gloves, and provide perineal care, just as I stated earlier with a man and with a woman of how to do it. So now I would raise the side rail up, lower the bed, make sure my patient's comfortable, have the call light within reach, and also when I'm disposing of excuse me, when I'm disposing of everything, I would take the stat lock off as well of my patient. Okay, so now I would document. Okay, so for documentation purposes, I'm going to document the amount, color, consistency, and if there was an odor to the urine. I'm going to document the intactness of the catheter tip. I'm going to document how much water was removed from the balloon. I'm going to document my patient's tolerance and then patient teaching of symptoms of UTI. So symptoms of UTI would be fever, chills, back pain, flank pain, and frequency or urgency to urinate. I also want to state too that, yes, so after the teaching of this, I would come back in within 4 to 6 hours of my patient to make sure my patient has voided, and if they have not voided, I would palpate their bladder and obtain a bladder scan. And this concludes my urinary catheter insertion. Thank you.